Well, my proposal is that you try to inform yourself as much as possible. One way to inform yourself is to use relation to your treating physician. The second one is that you use the internet, but that is always dangerous because there are so many misinformations also. And a very good way is to try to get in contact to patient advocacy groups, because there are many of those in different countries, and you should use these groups to get in contact with other people which are affected by the same problem. And you can exchange ideas, you can get a lot of information there. And so you use a mixture of boxes where you get out your information, but as it is a partner in your life, your disease, and it's a chronic disease which can usually not be cured, except in myelofibrosis when you go for allogenic transplantation. But most of the diseases like ET and PV are partners for your whole life, and you have to deal with them and to try to inform yourself as much as possible to be a competent patient. It has, in addition to the physicians and the experts, I mean, if you're in a rural area, when we are sitting here in a rural area, we are sitting in the local town like Innsbruck, but we have many patients which come from small villages and valleys in Tyrol or other regions of Western Austria. So, nevertheless, they have local doctors, and if they aim for a second opinion, it's easy to get in contact with experts in the field. And also there, the patient advocacy groups can help you because they have these informations. Where are the hematologists which are really focused on this group of diseases, and where you then really also feel comfortable. And this, in a ping-pong play with the local doctors, can optimize your treatment and also the information flow which the patient needs to be as much informed as possible. We know that it's a big issue for the patients. It's published that MPN patients and also other cancer patients have big problems in their sexual life. The sexual functioning, when you look at the MPN-SIF score, for example, is clearly impaired, and this is something which has many reasons, pathophysiological things which are based on the different behavior of the blood, but also of psychological and the severe fatigue, and also the problem of self-confidence. When you get the diagnosis of cancer, it destabilizes you substantially in all facets of life, and this also impacts sexuality in male and female. So it's really important that you talk about it and tell your physician, and also take a psycho-oncologist who helps you to get back this confidence, and also this very important part, which should be something which strengthens you and doesn't put you under pressure, which is often a problem. I'm not functioning in my professional life, in the family, but also then in my partnership. And this is, as I said, very important to talk about it. And my personal opinion that in addition to talking about it, it's important that you try to be as physically active as possible, because also the physical activity in terms of sport, and there are different ways of doing sports, whatever the individual patient wants to do, this really also strengthens your body feeling, your self-confidence, and this is something which helps you to be also more happy in your sexual life. Interferons are known to trigger the antiviral immunity. In our body, interferons are endogenously produced, and they can enforce, for example, antibody production. So it could be that patients which are under interferon have a lower likelihood to get infected, or also more quickly clear the virus, but that is an hypothesis. What we know that in the later phases, the disease which is induced by SARS-CoV-2, the COVID-19, which primarily affects the lung and the vessels, is induced by a very strong inflammation. And we also see a strong inflammation in myeloproliferative neoplasia, which is inhibited by JAK inhibitors. And we know also from early trials, non-randomized trials, that JAK inhibitors can be beneficial in this late COVID-19, to treat COVID-19, to improve the lung situation. So it's very interesting that those two drugs in the MPN field are also linked to SARS-CoV. But you can protect yourself, keep distance and wear masks and wash your hands and avoid, crowded rooms and masses of people. Well, there is a lot of interest in young physicians, but when you start as a young physician, you have a lot of opportunities in the department, because there are so many diseases which are interesting. And when you start to focus yourself and you say, I want to go into depth, this very much depends on the local situation. What is the interest of the senior physicians there? What is the interest of the head of the department? And I can just speak, for example, for our department, we have a strong focus on MPN, but also on lung cancer. And we build up groups there which make science, but also clinical research in these fields. And we try to be enthusiastic, but we are anyhow enthusiastic about, the developments we have, not only in MPN, but also in general in hemato-oncology. So I love to be on the ward and try to bring this spirit and this enthusiastic view of making medicine, that it's a privilege that we are in these times to make medicine where we get so much new knowledge about the diseases and that we transfer this to our patients. And I think my personal impression, since I'm head of the department here, that the enthusiasm is very high in the young physicians. Things which have really advanced is the understanding of the disease in terms of genetics. So we have a lot of genetic information, which helps us to understand how the disease is evolving. But we still very much struggle on understanding how the inflammation is really triggered and what are the key mechanisms of the inflammatory processes. And most importantly, we are not really understanding what is the individual risk for getting thrombosis, which is a major issue. I mean, it's okay, it's the increased blood counts, but that's not all. So what are the mechanisms of getting splanchnic vessel thrombosis, for example, which can be very problematic for patients with MPN. And pathophysiological mechanisms and the risk factors are not sufficiently understood, because we need to know who are the patients which will eventually later on develop thrombosis, even though they have a low risk of getting a thrombosis, to prophylactically, in a prophylactic setting already do, for example, anticoagulative therapy. So this is a very important topic, and we also need to understand better what is the small fraction of patients which really quite quickly progresses to a severe phase of the disease, which is life-threatening. And this particularly means the transformation to acute leukemia, which is nowadays called MPN blast crisis, but which is life-threatening, which needs allogeneic transplantation usually, and which can really be very dangerous for the patients. So there's still a huge need to do research in preclinical and clinical settings. And the patient perspective is also, I think, not sufficiently understood. So we need more data on patient-reported outcomes. We discussed sexual life, for example, but other facets of impaired quality of life from the patient's perspective. I mean, we started all this with developing the MPN-SIF scores and some scoring systems where we try to better understand the patient's well-being, but we need more innovative, potentially settings where we need digital medicine to get better contact to the patients, to you, to know how, because quite frequently you come every 3 months, and that's just a very focused report. How do you feel in those 30 to 45 minutes or whatever you have with your physician? And we need to be in closer contact probably to get the waves of feeling better, feeling worse, the fatigue and all these issues, trying to then better modify and also coordinate treatment. I think to improve also the understanding of the patient's perspective, it's a prerequisite that you as patients are really frankly open, not only in speaking to the physician about all the aspects which touch you in daily life, but also in providing data for larger projects where we try to integrate your perception into novel models, how we can improve the management of the disease.